All right, so we are expecting Professor Ato Ama to join. While he joins, or before he joins, I would like to see if we can get an introduction, a brief introduction on him. And I want to again share my screen to show you one thing. I mentioned in the morning that I've actually updated the spreadsheet on the course schedule, so you are able to access the profiles of our presenters. So I'll simply share my screen to show you how you can get that, so that if you don't get all the details here, you are still sure that you can actually find out about the presenters later and contact them if you want to. All right, so to our Teams platform, all you have to do, if you are within your Teams, make sure you are within the Research4Life team. And if you're on phone, you may have to touch the general channel. If you're on PC, you can straight away see files over here. Click on files, and you will see the only Excel or spreadsheet document here. That is the course schedule. Now, when you open the course schedule, you realize that the links to download the first 3 themes for week 1 are all active. You also see that the profiles of our presenters are also active. All right. So as a demonstration, I'll link up from here to Prof. Atoama's profile. What I have also tried to indicate is the fact that researcher assessment can be accessed in various ways. Researchers themselves try to create profiles. We have Google Scholar profiles, we have the AuthorAid, and in the first presenter's case, I showed her AuthorAid. I think it's just here, I can just click for you to see. So this is the AuthorAid of Dr. Louise Bezudnot. You can read all about her profile, her qualifications, work, employment, papers, everything. And you can get in touch with her. She has already shared her email with us. Now, in the second presenter's case, I decided to use another system. It's also about researcher recognition. He has created his profile on the Web of Sciences Pablons. So apart from AuthorAid, we also have what we call Researcher ID. You can see here, Researcher ID from Web of Science. And Pablons is where his profile is. He will be talking about some of these resources during his presentation, I guess. So if you want to find out about the profile of Professor Frederick Ato Ama of UCC, he is actually currently the Director of Research, Innovation, and Consultancy, and his special area is environmental science at the University of Cape Coast in Ghana. I hope he has joined. We'll check and see if he has. Then we'll allow him to proceed and give us his presentation, and we'll also give yeah.
Hello, Fred. Yeah, before we do that, can I just say something about the Pablons?
All right, please.
So the first presenter was talking about open reviews, where reviewers are expected to even share the reviews of articles that they do. So on this particular page, Prof. Ama has reviewed 220 verified articles. So this is one way to share reviews so that authors can actually know what transpired behind the scene. Of course, reviews are supposed to be double blind, but behind that, people want to see what happened. That was what the first presenter was talking about. So people tell, as part of their profile on Pablons, you can actually tell the number of reviews and what articles you reviewed. Thank you.
All right, thank you very much, Dominic. All right, colleagues, while we are waiting for Prof. Ama to join, please let your questions come. Use the chat box, or if you have any issue to discuss, not only questions, please. If you have any observations to share, you have any additions to make, you have any contributions or insights, please let's share so that all colleagues can benefit. All right. Like Dominic has just shared with us right now on Pablons, maybe you are a researcher or you are interested in researcher assessment and all of that. I don't know how many of us here have Google Scholar profiles or who have been doing something in the way of publishing. We know there are so many NGOs among us, and they have been doing a lot of data work. They create or generate a lot of data with community programs that they have been implementing. We have looked at the responsible conduct of research. We looked at the framework, and we saw in Open Science that the issue about management of data and all of that is there. I'm sure that from this point, a lot of our CSOs will start looking at the possibility of working together with the academics and researchers to handle their data in a way that projects their CSOs and makes them viable for project grants, because I know that a lot of data reside with them in their report. They do a lot of reporting to donors, but whether they move forward beyond the report that they generate from the data to actually publish and create public knowledge of what their work around the communities has been, we really do not know, okay? So let's look at how we can strengthen each other in that area, that the NGOs or the CSOs in agric and health within the region can also make their data available for publication and reuse. All right, thanks a lot, colleagues. Prof, as we're trying to join, I think he has some technology issues, so we'll bear with him. In the meantime, I'll introduce the third speaker as well. He's also coming from the US, Lenny Ryan. I'll again go to our schedule. I try to link his online profile to the schedule, so we can see the link is active here. So for Dr. Lenny Ryan, he is actually very closely associated with this project. He was formerly of the University of Florida, if I'm not wrong. He is actually the coordinator of e-library training initiatives for Librarians Without Borders, the sponsors of this particular training program. So he's working closely with the Medical Library Association, and he is a mentor. So I think one of the channels we looked at on the RCR, that's a responsible conduct of research framework or concept, was about mentor-mentee relationships. And you can see that this profile, I picked it from the AuthorAid platform. I really want to give a reminder again that as in the opening session, I made mention of one design of this course, that some of the things that we are going to be learning are going to be latent. They are latently built into our interactions so that they are not instruction or reading based, all right? So if you observe, even as I try to link to the profiles of these people, I try to diversify the sources of their profile. They have multiple profile sources, but for the first speaker, I decided to use AuthorAid because I want us to get familiar with what it is, providing persistent access to researchers' profiles and all of that. For the second speaker, I decided to use Pablon's Web of Science Author Researcher ID, which is similar to the AuthorAid. They all do the same thing. I also mentioned something about Google Scholar profile. Then now I'm referring to Lenny Ryan, and I'm talking about mentor and mentee relationships. And you can see I'm on the AuthorAid platform. All right. So for those of us who are not familiar with most of these resources or researcher profile platforms, this is a great way of getting introduced to them. AuthorAid and INASP have been doing a lot of work on publication and support for early career researchers. There are so many volunteers ready to mentor the young ones, okay, to come up with their manuscripts, get the right publishing venues in order to avoid predatory publishing and all of that, working through all the quality assurance process, making sure that you can actually get your publication in the right places. So this is Lenny Ryan in short.
Okay. I have one. Good morning.
Yes, welcome, Lenny.
I have one more. I would like to open one or two files.
All right.
Okay. And then I'll be with you. It shouldn't take long. The one is the presentation, and the other is I want to open. Late morning, everyone. I'm 4 hours behind you, and I'm glad to be able to join and do an overview of Research4Life and a kind of preview, which I thought was very important. I was very pleased to hear the previous speaker talking about AuthorAid, because Research4Life we're looking at what our role is with publishing, and one thing we want to do is work more closely with AuthorAid and INES so that everyone, our constituency, our users know about their resources, because they are a very valuable and dynamic organization. Okay. Should I just go right to my presentation?
Yes, please, Lenny, go ahead.
Okay, I just have a very quick story, and this is how I met Fred. I used to do face-to-face workshops before the pandemic, but now I teach at odd hours, like 7 a.m., 8 a.m., and we did a master trainer course in Asia, and I had to teach at 22:30 and 23:30, but I'm ready now. So let me open my, share the screen, assuming it works. Okay, let me do this. Okay, I want to share my screen, and it's going to be this one. Okay. And then all I have to do is slideshow. I'm trying to screen. Okay, and let me minimize this on my screen. Can everyone see this? It says Scholarly Communication and Research4Life, correct?
Yes, please, you can see.
Okay, we're ready to go then. I would like to do, let's see what it says. It says introduction, Research4Life partnership, collections, eligibility, Group A, Group B, user agreement. That's all the background. Then I want to talk a little about, as a preview, access to Research4Life collections, and then the unified content portal, and of course, search across all Research4Life. Just to preview that, I'm not sure, but I may be teaching this later on another Wednesday, and then mention the Research Help Desk, and then we can go in and do some searching if you'd like. Okay, I have about a half hour, I think. So the learning objectives are learn about Research4Life partnership, collections of Research4Life in their subjects, factors for eligibility, user agreements, terms of use, and access and authentication system. Okay, so the background is, of course, that there's a wide range of scientific literature which was out of reach to universities and research institutes in low-income countries. The subscription cost for a single journal would be several $1,000s, which was basically impossible for you in your environment. Research4Life was created in 2002, starting with health, to reduce this knowledge gap between high-income and low and middle-income countries, and it provides affordable access to the important scientific research. But as I'm thinking the previous speaker talked about, this is only part of the situation. What you do with the information and how you do research and how you publish it is another equal component. Okay, so what is Research4Life? It is a large collection originally based on 5 programs, but I'll talk about the transition we're kind of going through. On health, agriculture, environment, scientific and technical information, and law and social sciences. It has more than currently 10,500 registered institutions from 125 countries, territories, areas, And I think refugee camps are also eligible. Up to 129,000 books, 30,000 journals, and up to 155 other resources. The other resources is an area that I kind of feel is neglected. Many of these resources are underutilized. So perhaps we'll, at this presentation or another one, we'll talk about that a bit, okay? You're all in universities, I think, professional schools, research institutes, of course, teaching hospitals, government offices, et cetera, and local NGOs are allowed in. And about 4 years ago, we set up a situation where the World Health Organization and other UN agency country offices were granted access. Okay, so we have, this is complex and I never understand it perfectly. There's many different factors if a country is eligible. Basically, there are all these criteria, and if the country meets one of them, they are eligible. And then there's the issue of Group A and Group B. I'll get to that. The total gross national income cannot be above $1 trillion US, then they're not eligible, regardless of the other factors. And this eliminates a country like India. Okay. Oh, did I go the wrong way? I'm sorry. Here we are. We have two groups. Ghana fits in the Group A, free access. You're not on the UN least developed country list, but your GMP is low enough, your gross national income is low enough so that you fit in one of these criteria and you don't deal with paying the $1,500. Where this gets complicated, I don't think I have this on a slide, is that publishers, it is a partnership, and publishers can choose to grant access or not to a country. So some of the major countries may say, oh, we think we can get a consortium together and earn some money, have a consortium pay for access to X, Y, or Z set of journals and books. And we're not going to grant access in this country. And I'm sure you're all aware of this when you use the resources. Fred, you can correct me if I'm wrong. You also can add anything you want at any point. Please feel free.
Thanks.
Okay, so here we have Group A and Group B, and you are in Group B, which is the blue, and I've been to your country, but I cannot exactly identify which small little country it is on the western coast of Africa. But clearly you are in Group A, that's what's important. Then we set up Research4Life, a signed user agreement between the registered institution and the publisher partners of the country. In other words, Research4Life acts like a huge institution, and it gets the authority to give access in many cases to the various registered institutions. But the registered institutions have to follow the same rules as if it was an individual subscription, okay? So then we go on, we'll talk briefly about that. What you can do, share the passwords with colleagues, students, or faculty members at your institution. Download or print up to 15% of a journal, issue, or book. Use the material for educational purposes. Course packets, reserves, making copies for members, etc. That's called fair use for educational functions, and you can use it on personal computers, or it should also say mobile phones now, because I'm sure many of you have done that. Okay. What you cannot do is share the Research4Life username and password outside your institution, post it on websites. This will cause access to stop, especially if somebody who has the robotics type program that can pull off many different articles or book chapters. So then you'll see that you can't log in anymore, and you'll have to contact the help desk. Okay. This one, okay, access Research Life remotely from other installations than the usual devices or devices owned by employees, faculty members, or student institutions. That has broken down a bit, especially the one about traveling outside the countries. If you go to a meeting, say in Geneva, say in London, and you have a week and you know your access is going to be better and you have a whole list of articles you want to capture the PDFs and download, that is allowable under circumstances. But if you see somebody coming in from London for 3 months in a row, that is not allowable. It's also allowable for distance learning now. Download, you can't download or print a complete journal, supply documents for a fee, et cetera, et cetera, et cetera. Change the work, okay? So I think you have an idea of the limits and also what you can do. What's not mentioned here, and many of your institutions may have it, is there is a way of setting up the IP addresses so that for a set of IP addresses, users can automatically log in without going through the password and all that. I don't know which institutions have it or not. Fred, do you have that at your institution?
No, yeah. No, we use
okay.
the username and password.
Okay, okay. You may want, some people may want to look into that.
Yes.
Now, okay, just write to the help desk and they will give you start you on the process. Okay, that doesn't mean that you can also, if you're on a personal computer, you can still use the user, or a mobile phone, you can still use the username or password. Now, there are 5, what used to be programs, and you're familiar with this, especially if you're in health or agriculture. There was one for research and health, research and agriculture, there are the names, environment, development, innovation, and starting about 4 years ago, global justice. Each one has a different mix of journals from the complete composite list of journals and books and resources, okay? But as we evolve into using more a unified content portal, we're now calling these collections, okay? You will still, and I will show you, you will have access to only health or only environment information if you choose, and it's very easy to do, but we're calling them collections, although there's 3 different content portals, which I'll talk about in a minute. Okay, oh, I hit the wrong key again. Okay, so here's about research grants access 2 ways, through institutional IP address and also through institutional login credentials. Okay, registered institutions are recommended to use the IP addresses. It provides seamless access. People don't have to remember their usernames and passwords. Okay, there is now consistent, what's it called? There's a method where you can log in and have a persistent login that's good for 3 months if you use the same computer and don't clear the cache. But that's a different issue too. We still prefer, it's easier if an institution uses the IP address. You register it in the IP registry, validated by Research4Life, and then you can go ahead and use that option. Please contact the Research4Life help desk and they will start you working on the process. Okay. Now, that's the background. And now I kind of want to go on to what is going on in the last 3 months, because this started July 1st. Many of you have seen how the portal has changed. Okay, it is now basically 3 different content portals. The unified content portal, which I will talk about mostly, gives you access to 5 discipline collections, we're calling them now. There is the URL. There is also one for Agora, which is in agriculture, and RD, the research and innovation. And you can go directly to a portal with their information only, although that is available in the unified content portal. The reasons for this have to do with the dynamics of UN agencies, and to be honest, those are things I fortunately don't have to deal with. Okay, so now, and you can also access it from the initial Research for Life page, there's a tab along the top that says Login. So what does this look like? Here's what comes up. Initial display. Once you try to log in, once you click on any of these URLs, you get the same exact sign-in page. Put in your institution username or password, or if it's already automated through the IP address and your computer is one from the institution, it will go automatically. So then you have access. I have to, okay, this will help me. All the instructions for how to use Zoom were on part of the slides for me. I don't think you see that. So then you get this new box, this new Welcome to Research for Life box. If you have logged in, you see up on the right side there, you see a little symbol, and that means you have logged in properly. If you haven't logged in, it's a darker box, okay? And then it gives you, if you click on it, credentials, it's showing that I have signed in with a trainer password, okay? And that gives you the information. For this, it's national non-governmental login, et cetera, et cetera, et cetera. And this has changed from a dark box. So now you are logged in. Now it doesn't want. Okay. First thing to note is if you click on the collection, excuse me, if you click on the collection, you immediately go to any of the 5 former programs. So you're at an agriculture institute. I think, Fred, doesn't your institution have an agriculture program? Correct?
No, we have health.
Excuse your health. I'm sorry, I got mixed up. So you would click on Hanari if you only want the health. Okay. The next slide will show you the Agora collection. Here it is. You see, you can click, it says click home if you want to get rid of it. It will remove it and go back to the more generic one. And there it says Agora, content associated with Agora. You have a whole series of filters in the left column. Again, it can be the content type, obviously, is there. The collection is a content type. You only want to look at books or journals or publishers or reference sources, etc. Now, one of the keys is previously you saw the box that says search across Research for Life. And that is a summon search tool. I'll talk a bit about that because when you are searching in this unified content portal, you're not doing keyword searches. You're looking at all the journal titles, all the book titles, all the reference sources, all the databases, but you're not able to do a search. So if you go up to the little magnifying glass and click on it, the search box appears, and this allows you to do a keyword search. And we'll show you this a bit. Note right below it is the access key, titles provided, other access content, free content, no access. So if you are, if a publisher is not granting access, the box over here will be black. Okay, we hope that most of the publishers grant access. In Ghana, I think there are a few that have chosen not to. Note again, Agora and Artie have separate content portals that you can go to. Okay, let's see now. We're opening the content options. You see journals, books, reference sources, databases, free collections, publishers, recent resources, and subjects. Again, you're searching the titles of the material, the databases that's available at your institution, okay? So we're going to open databases. Again, I mentioned about where to get the search. And here we have databases. We have a total of 43 listed. If you wish to only limit it to health, you click on Hanari here, and then 31 shows up, okay? So you can scroll down this and find health-related ones would be PubMed. I always tell people to look at Google Scholar. I always say there's a reason to use Google Scholar, and maybe I'll show that to you. PubMed is here, Cochrane Library. So you have certain health-related ones. You can see there's certain agriculture ones. So the mix can be sorted that way. Let me go on. All right. I'm sorry. Okay, a very useful tool is Browse by Subject. Again, it's going to give you book titles and journal titles. You have to remember that. Database titles, reference source titles. Displayed is the first 20 of 193 different subjects. They're topics for all the program's disciplines. Okay, each contains a list of books and journals that fall under the topic. All right. We have not, I have a really good example. I didn't use it here for biodiversity, and it lists all the material on biodiversity. One other thing I wanted to mention, if you're in a specific program of a specific collection, or you're only listing journals, if you click up here, it's listed, and then you unclick this and you go back to the broader Unified Content Portal display. Okay, let us go on. A couple other features that I find valuable are search content and personal sign-in. Okay, these are from this drop-down menu that you see over here, right next to the figure that says that you are logged in. So we're clicking on those three horizontal lines, and it says search content and personal login. Search content is really useful if you're looking for an individual journal title or book title, or you want to see all the titles, all the publishers. You see in the right-hand column, it says you can type search by all fields, published title, author title. So you want to see only the titles that say public health. And you want to see if there's any publisher. Well, all fields would give you publishers and journal titles and book titles in public health. And you can sort this by relevance. So I didn't show you, but there's a long, if you go into the page that says publishers from the collections, there is no, at this point, although we're hoping to add it when we add some features that weren't in the original launching, an A to Z list. So you may be looking for a journal like the Lancet, and then you'd have to scroll all the way down that list and keep hitting more and more and more the list of publishers, or journal titles. So here you can enter Lancet here and click on publication title, and you'll get access to it much more directly. Okay, there is an option. So now we have gone back here, we've clicked on personal sign-in, okay? And here's where you can either log in if you have already set up your personal sign-in, or register. And once you register, the personal sign-in will be displayed below the figure that says you have access. You click on that, and down at the bottom, it says, here's my ID, here's my user ID, and it says the profile has been activated. So what you really want to know is, what does this do? Why do you want to have a personal sign-in? Remember, you'll have to be signed into Research4Life, and then you go to this. It allows you to save a search you've done. I've got all the journals on public health, and I want to save that search so I can go back to it and don't have to do it again. I have all the databases listed for agriculture or environment. I don't want to have to go through that again to identify them. Okay, you can view your search history, and you can create search alerts. So if a new journal or book is added to public health, you will be notified. It doesn't still deal with this whole issue of searching topically, keyword searching. So we're going to quickly look at that. Oh, last but not least, in this, we're back in the menu, and it says country offer. And this is very useful, and I just did this last night. I selected Ghana. I selected a university, faculty, and college. And this tells you very succinctly what publishers are granting access. Okay, previously you could also see which ones weren't, but this is not available in this option. So we have here Ghana, we have here university, faculty, and college, and you can see that you have access to 51,000 books, 7,500 journals, 46 reference sources, and 9 databases. And you would scroll down this and there'll be an alphabetical listing of the titles, the publishers you have access to, and there's a little code here, okay? The code is the green, the star, beginning, you'll be eligible next year, you won't be eligible next year, etc. Okay, so 2 ways to get to this. It's called Search Across All Research for Life, ... But we also know it's the sum and search function. So you go to the original Unified Content Portal page, you can search right there, or you can click on the magnifying glass if you're in the content collections or any other of the options. Okay, so we'll very quickly do hospital infections and developing countries. This is one of your lessons, so you will learn much more detail about it. But I just wanted to get it in your mind that this is a really valuable tool when using Research for Life, okay? And here we have the results, 1,863 results for quote unquote hospital infections and quote unquote developing countries. If you take the quotes out, it's a much larger search. There's a nice option to add results beyond your library's collection. What you are getting here is what the publishers grant access to in your institution. And you can see you have journal articles, book reviews, publications, book chapters, and full books, okay? So we have here, we have journal article. You can click on full text online. You have a preview option. This will be discussed later on, but this is where you will do your searching, and assuming this is working correctly, you will have access to everything listed here. And it does a very good job of adding book chapters, okay? If you need help, go to the Research for Life help desk. There's a checklist of issues they want you to list. What is your institution's name and country, username and password? Do you have institution IP-based access? Are you able to log in, or you get a failure to authenticate message? If you can't log in and several people can't, maybe the password has been corrupted. Are you having problems with all content or a specific journal? In other words, you send them the instructions so they can check on it. And they try their best, and they're very diligent about saying, okay, you have done everything right. We're having a problem with that publisher. Okay, that's why they ask for a screenshot, a screen capture, including the URL of the problem you're having. You go to a publisher, it's got that little P mark. You go to a journal title and it says pay $35 US. That's a mistake if you have confirmed that you have access to it, okay? This introduction introduces basic information about Research for Life. Yes, we did that. And it all included a brief overview of Unified Content Portal and searching across all Research for Life. Okay, thank you. And here's how you can contact Research for Life. There's our website, Twitter, Facebook, Instagram, and also the help desk email address. Okay, that is it for my presentation. I'm hoping that's what, okay, now I'm closing, screen sharing is stopped. I have only 5 more minutes because I have to go to do a workshop, a larger a webinar at my 8 o'clock, your noon. So is there a quick question or two? Okay, UHAS, The categories are not about publication waivers. Oh, that's a question. There's a question up here. Regarding publication waivers, does grouping accommodate collection authors who are outside of Group A, assuming corresponding authors is from Group A country? Publication waivers is a completely different issue. If we went, I could show you where there's some information on that. And I can't say that the categories are linked to publication waivers. It's more up to individual organizations, individual publishers. But if I have time, let's see if I can do this quickly. Okay, because I only have about 3 more minutes. I'm going to call up research. I'll have to display this. ORG. Okay, let's see. All right. In training. Okay. Now I'm going to go and share this screen very quickly. Okay. I have to share screen, and it's this one. Okay. So now I'm in the Research4Life database. Has this displayed? Yes?
Yes,
Good.
please.
Okay. I'm going to click on webinars. Okay. And if you scroll down, see, there are a lot of useful webinars, some in Google Scholar, about Goali program, how to join and use Research4Life, different publishers. If I had time, I would talk about Dimensions. It's a very dynamic database. We scroll down, open access. If you click on this one, there is a discussion of the issue you just talked about and open access and granting waivers. Okay, so I would suggest either download the PowerPoint or listen to the presentation. But it's too often based on individual publishers, although Research4Life is trying to work with them to get the publishers, at least the major ones, to be more uniform about how they grant these waivers. I hope that helps. Okay, I'm going to stop sharing. And now I'm back on. I think that's the end of your session, isn't it? You're coming to your end, Fred, for the day. You have 15 more minutes, but I cannot stay on.
Yeah, no worries. We actually have a third presenter waiting.
Okay, great.
Yes.
Just send me my assignments and I will be happy to do any of the presentations that you need me to do.
Most definitely.
Starting at 11 a.m.
Yes, sure.
That's our agreement.
That is fine.
All right. We'll email, but I thought this went well.
Yes,
I hope
just before you go, Lenny, just before you go. Yes, for us in the health sciences, there have been a lot of demand for MBase. I want to find out the MBase database, I think by Elsevier, do they also grant access to category A countries like the Ghanaian institutions?
Some. Now, if you go back to that, list, granting access, you will scroll down and you probably will not see Elsevier listed there. But Elsevier is tricky if you are in a teaching hospital. Is your university attached to a teaching hospital?
Yes.
Yes. If the teaching hospital goes in and registers, they may have access to some of the Elsevier resources. Let us talk about this later on, but you may want to have the hospital register separately. It's a very complex thing because they grant differently to universities and teaching hospitals. So we'll discuss that later on. Okay?
Oh, okay. And there's one, there's one in the chat for you quickly. I know you are already tight on time. Yeah, somebody was asking the 15% download. Is it applicable to the institution or the individual who is accessing the resource?
It's more the individual.
All right.
But I'm not sure this is really paid attention to. I've said this maybe 150, 200 times, and I'm not sure if it's really tracked or not. Okay.
Okay. All right.
All right. I'll be back.
Yes. Thanks a lot.
Like you had a great start. It looks like you had a great start to your training. I'm
Yes,
so glad
please.
it's begun
Thank
after all
you.
these delays. Okay.
Yeah.
Bye for now.
Yeah. Bye-bye. All right. Thanks, everyone. So that was Lenny. Of course, you are going to be meeting him so many times within the course of our training, because he is actually, as I introduced him, the coordinator or the head of e-resource training at the Medical Lab Association's Librarians Without Borders. And he is actually championing this health and Greek staff. I mean, all the Research4Life staff. So you will meet him severally on many of the modules for how we can access and use the resources.